My name is Hannah and I'm Chief Exec at Trevi. Jasmine Mother Child is a residential family centre, and our specialism is working with mums who have had drug and alcohol issues, substance misuse, being able to carry out a parenting assessment but also understand and work with issues around recovery. First and foremost, what we want for children here is that they're safe in the care of their mum whilst decisions are made about their longer term future. We also want to make sure that the needs of the child are at the heart of that decision making process, and that as services, as professionals making decisions, that we keep our eye firmly on the needs of the child. The number of children going into care is continuing to go up. We've seen the numbers continue to rise, and of course we're worried about this in terms of the impact for children going into the care system. We're also worried about the impact on women of those removals, often repeat removals of children. But there's a wider social issue here as well in terms of the impact to society and the cost to society. And we know that if we can get an intervention that can help prevent those multiple removals, then there's a clear financial benefit to society as well as the social reasons to do this and to get this right for families.
I am Margaret Bearsey. I am the Registered Manager for Jasmine Mother and Child. Jasmine is a secure site with self-contained flats. It has a shared garden and can accommodate 10 families. At Jasmine, the services we offer are strength-based parenting assessments for mothers facing substance misuse issues, comprehensive interventions under one roof. We offer a workshop programme which is tailored and therapeutic, and we offer wraparound trauma-informed support.
Parenting assessment is really important because we need to be able to make decisions for children about where they can live longer term, about whether or not they're safe in their mum's care, and actually what support a mum needs to be able to keep her child safe. So having a social work-led parenting assessment in a supportive environment is really important, and that's what we'll be providing here at Jasmine. I think what's really unique about this service is the focus around recovery. What we've seen over the last few years is an increasing need for parenting assessments, but in cases where the primary issue is drug and alcohol, and that's what we're providing here. We'll be offering an assessment programme, so we will have social workers who'll be meeting regularly with the family, with the mother, offering feedback, making sure that there's a really good plan in place for the mum to work on, the areas where she might need additional support, but also making sure we have some interventions here to support the mum in that journey.
The assessment will be over 12 weeks. Within that 12 weeks there will be work around the detox and the rehab, and alongside that will be the parenting. And the observations 24 hours a day. That will form part of the parenting assessment. All of it is trauma informed.
When we talk about making sure we've got the right support for women, we need to make sure that we're able to understand the trauma that the woman has been through and get the right support in place. But for us, it's also making sure that the child is at the heart of our thinking. We know that to get things right for the child, we need to get the right support in place for the parents. So holding those two needs together is absolutely key.
We have a communal lounge area for the mothers and for the children, and we have a secure play area for the children that they can play outside in a walled garden that is safe. We also have a lodge where some of the group work will be undertaken. We have a sensory room for the young babies. Staff will be training the mothers how to use the sensory toys.
We've got a range of workshops we'll be running that look at trauma, that focus around relapse prevention, look at planning for the future, look at relationships, so all of the things that we know that the mother needs to work on to be able to keep her child safe longer term.
The child is the centre of all our work. We have courses in nutrition for the body to recover from substance misuse. We have one-to-one counselling sessions, one-to-one therapeutic sessions, courses in recovery maintenance, recovery capital, the Freedom Programme, the 12 steps, and the Sally Ho parenting course. There is also external courses which is out in the city. We're based very central, so it's easy for them to access.
This service is absolutely part of Trevi's wider vision. We have been working for 30 years now, trying to provide the right services for women and children. And for us, we never want to be afraid to innovate, to offer something that's new, that's different.
The staff at Jasmine is an all-female staff. We have 2 assessing social workers. We have 12 family support workers working different shift patterns, daytime, night times and weekends. We have a nurse practitioner. We have a doctor who visits us weekly to oversee the meds and meet with each and every one of the residents, and that is about working with them on their recovery and the appropriate meds. We have a counsellor. We have a child psychotherapist who will be coming in to work on attachment. We have a team lead who manages the team of family support workers, which also will include the bank family support workers. We are dual registered with Ofsted and CQC. I'm very proud of the environment and how it is looking. It is certainly very child focused and a very warm, welcoming place for residents to come into. We look forward to working with you all.